possible local acquired Chicago Clade Ib Mpox case prompts Caribbean vigilance. Cayman Islands investigates confirmed Legionnaires disease case. Major Saharan dust plume of the season approaches the Caribbean. Tobago health officials sound alarm over rising STI rates among young people. Barbados government sued over alleged COVID-19 vaccine injury. These stories on today's episode of Health Across the Island. Thank you for joining us on Health Across the Islands, your Caribbean weekly health news briefing. I'm your host, Natasha Robbins Connor. A Chicago resident has been diagnosed with Mpox Clade Ib despite having no recent international travel history. Health officials say that the individual has recovered, and while no evidence of community transmission has been identified, investigations are continuing to determine how the infection was acquired. This comes roughly 6 months after the last U.S. Clade Ib cases were reported in California. There is currently no evidence of Clade Ib transmission in the Caribbean, although the region remains on alert because of close travel links with the United States. Mpox is a viral disease caused by the monkeypox virus and spreads primarily through close physical contact, including direct contact with an infected person's rash, bodily fluids, or contaminated materials. Symptoms include fever, swollen lymph nodes, headache, muscle aches, and fatigue, followed by a rash that develops into painful blisters before scabbing over. During the global Mpox outbreak in 2022, confirmed cases were reported in several Caribbean territories, including the Bahamas, Jamaica, Barbados, and Trinidad and Tobago. Health officials say the latest case highlights the importance of continued surveillance and public awareness, even in countries where no local transmission has been detected. Health authorities in the Cayman Islands are investigating a confirmed case of Legionnaires' disease, a serious form of pneumonia caused by inhaling water droplets contaminated with Legionella bacteria. The bacteria are commonly found in poorly maintained water systems such as cooling towers, plumbing systems, and hot tubs. Officials have not confirmed whether the patient is a resident or visitor, and investigations are underway to identify the source of exposure. Symptoms often resemble the flu and include fever, cough, shortness of breath, and chest pain. Severe infections can rapidly progress to pneumonia requiring hospitalization. The overall case fatality rate for Legionnaires' disease typically ranges from 5 to 15%, meaning roughly 1 in 10 infected individuals contracting the disease will die. Legionnaires' disease is considered uncommon in the Caribbean, with most reported cases occurring as isolated or travel-associated infections. It does not spread from person, and what is critical in preventing additional cases. Health officials say investigation in the Cayman Islands remain ongoing. Health and meteorological officials across the Caribbean are warning that the first significant Saharan dust plume of the 2026 season was expected to affect several islands over the weekend. Countries including the Cayman Islands have issued health advisories, warning that the dust could reduce air quality and worsen respiratory conditions. Saharan dust consists of fine mineral particles carried thousands of kilometers across the Atlantic from the Sahara Desert in North Africa. The first plume of this season reached the Caribbean at the end of May, with another denser plume forecasting to be affecting the region. While Saharan dust often creates hazy skies and colorful sunsets, it also contains fine particles that can irritate the eyes and the respiratory system. People with asthma, allergies, chronic lung disease, young children, and older adults are most at risk. Studies have shown that periods of heavy Saharan dust are associated with increases in asthma attacks and emergency visits for respiratory illnesses. Health officials recommend limiting prolonged outdoor activity, keeping asthma medication close by, and wearing a well-fitted N95 or KN95 mask if you're especially vulnerable and must spend time outdoors. Health officials in Tobago are raising concerns over increasing rates of sexually transmitted infections among young people, citing inconsistent condom use, delayed testing, and low-risk perception as major contributing factors. The Tobago Health Division is encouraging routine screening, earlier treatment, and greater public awareness to help reduce transmission. According to regional data from PAHO and CARFA, Trinidad and Tobago is among several Caribbean countries reporting a relatively high burden of sexually transmitted infections and HIV. Other countries include the Bahamas, Jamaica, Guyana, and Suriname, although disease patterns vary by infection. Health officials remind the public that many sexually transmitted infections cause few or no symptoms, making regular testing and consistent condom use the most effective ways to reduce transmission. A Barbadian woman has filed what local media describe as the first known vaccine injury lawsuit against the government of Barbados, alleging she suffered serious medical complications after receiving 2 doses of the Oxford AstraZeneca COVID-19 vaccine through the National Vaccination Program in 2021. According to court documents, the claimant says that she developed swelling, severe pain, chest pain, fatigue, shortness of breath, and bruising approximately 2 months after her second dose, affecting both her health and ability to work. The lawsuit alleges that the vaccine was defective under the Barbados Consumer Protection Act and that the government was negligent in administering the vaccination program and responding to her concerns. Court filings also state that the Barbados Drug Service investigated what was described as a suspected adverse drug reaction, with later assessments suggesting possible vaccine-induced blood clotting complications and vasculitis. The claimant is seeking compensation for lost earnings, damages, and legal costs. The government has not publicly responded to the merits of the allegation, and the case remains before the court. If successful, this would be the first widely reported lawsuit against a Caribbean government alleging injury following a COVID-19 vaccine administered through a national vaccination program. These are your stories, making this week's episode of Health Across the Islands your Caribbean Weekly News Briefing. Thanks for joining in.